We were talking about the theory of change. Now, from the theory, let's move to practice. Let's see how to build a theory of change. What are the steps that we do? We have done already what are our stakeholders. We've done a mapping exercise. So the first step is identifying our stakeholders and the impact that we want to achieve. So always, you guys also know, policies always start with the problem or the goal that they have in mind. Like a poverty reduction strategy or a policy. Or let's say something that is related to a program that wants to work on reducing maternal mortality. So that's our impact. We always start with that. Because that's the larger goal we always have in mind, that I want to work on this issue. Next is, so for our theory of change, when I say I want to work on a particular issue, maybe there is already so much of work happening. So I need to create or think about an evidence of what already exists on that issue and what needs to be done further. Because there's no point in doing something that is already being done by someone else. I don't need to replicate the efforts with so much amount of resources maybe if it's not needed. So I collect evidence and try to understand my context for my theory of change, right? Next, I have identified and agreed, so what are my long-term goals? It can also be one. Generally, it's one or two, but the longer-term goal that I want to achieve with my program. If at times the programs are very, in a greater time period, let's say a 10-year one, they sometimes might have couple of impacts that they want to achieve. And sometimes because the impacts are interrelated, so they can have a couple of those. So I identify the impacts. If you remember the results chain, we were going from input, activities, outputs, outcomes and impact. While developing my theory of change, I always go backwards because our activities are something very defined. So I won't have a list in my head already, but I will always have my impact in mind. I want to achieve this goal. So that's where I start with, and I start going backwards. So before impacts, we had our outcomes. So from that impact, how am I coming to my outcomes? The longer term. So for instance, my maternal mortality, one of the outcomes that I can improve is increasing institutional deliveries. So if more women give birth in hospitals, that might reduce the chances of women dying during childbirth because they have the facilities. Now going backwards from outcomes, I come to my outputs and my activities. So outputs, if you remember, are my immediate results or the short-term results that I want to achieve. I have identified outcomes. I have identified what are my outputs going to be and what are my activities going to be. Once my activities are there, I know what I'm going to do. I also need to identify where are my resources going to come in. So if this is what I want to do, I need to start finding people who can work on that, who can help provide infrastructure, who can give me budget or money, or budget could have already been there and you might have had a budget for a goal and you have defined that. But for people and such, you will always need to think about. You need to start hiring people to do activities. Assumptions, a critical part of it, that for reaching my output from my activities, what will be my assumption? For reaching my outcomes from my outputs, what will be my assumptions? And the risks associated with my assumptions. And lastly, I draw my linkages. I draw my arrows from my activities. Which activity will lead to which output, or which output will lead to which outcome. And eventually, all of the outcomes will lead to an impact. So those are my critical steps, and key aspect here is we are moving backwards. Assumptions and risks are also very important here. Now, let's move into how to articulate the theory of change so that it is measurable. Because if you remember, when we discussed about results-based management, we said the results need to be measurable. We all discussed about, let's say, a lowering levels of drugs and substance abuse, or an availability of water supply, right? We need to frame it in terms that is more operational, more measurable, more describable, that I can achieve those. So one aspect of a representation of that change flow is what I called a results framework, where I try to define my results in a more measurable format, right? And how I'll achieve my goal. So that results framework always maintains this cause and effect relationship. If and then effect that I want to explain, it will follow the same path. It will just be a more operational or more practical, usable aspect of theory of change, in that sense that how can I measure my theory of change. A key aspect of results framework, if I want to measure anything, I need to have an indicator. I need to put what I want to measure. My indicator is what I want to measure, what information that I want to get. And indicators are basically, therefore, the markers for the representation of my change. So my change can be an output, an outcome. So I need to have a representation of each of the level of my theory of change through my results framework. Now, every level will have its own specific indicators. For instance, if I was talking about awareness and sensitization, I need to measure it. So for that measurement, I need to describe that this will indicate that I have achieved awareness, how to achieve that, right? So a basic definition of what is an indicator, it's a unit of information. And it is something that is always think of it, that it will be measured over time. Something that I want, because I'm trying to see change here. So change is going to take some time. So it's the measurement over time. And it depicts change. And lastly, it's something that we observe, and its indicator, the good indicators generally won't be something that is either a negative value or a positive value, right? So key aspects, let's keep it as simple as possible. Something that is easy to understand. Something that if I show it to you, that something that I've created, you understand, or if you show it to me, I am able to understand. So simpler language is the key for a good indicator. Something that is measurable, so it always needs to keep in mind that I am trying to create a measurable unit of information. Something that is precise. Let's not be very vague. If it's very broad, very vague, it will be difficult to measure. So it has to be specific and something that can be easily understood and then measured. And lastly, a value neutral, that it will not be a positive or negative. It won't be increased knowledge levels. Because if I am measuring it over time, my value will depict whether an increase happened or a decrease happened. So the language of indicator will be a neutral language, that change in awareness. It can be a negative change, it can be a positive change. It can be examples, it can be a number of people trained, that's an indicator. It can be a ratio, a percentage, an average, a rate, a maternal mortality rate that a health department often undertakes is a indicator of change. Percentage of people who were trained. Out of the total employees, 95% people have been trained. So that's an indicator. Or it can be an index. Like the UNDP creates a world index, right? Or something that's very well known is the World Happiness Index, right? They basically, index means that we calculate a couple of indicators, we put together, we measure them and then create an index. That over these couple of things, when put together, this is what a happiness of a country looks like. Some basic examples or understanding for a indicator is that do we need specific indicators? Yes, we need specific indicator for each level. Separate indicator for activity, output, outcome, because I am trying to reflect my theory of change at each level, show my change at each level, so I need to have an indicator for each level. How many indicators should we have for a good theory of change? Let's say at least we should have one indicator for each activity, for each output. It can be more as well, but one should be there for each of the activity, output, outcomes. Can they change over time? They don't change over time, right? The value that is showing the measurement would change over time. So our indicators, they measure the same thing. It's just the values can be higher or negative. And they are often value neutral, so that does not apply. And can they be qualitative and quantitative in nature? Yes, it can be. So number of people trained can be, but the index as such can be a qualitative reflection. Okay, so we have some indicators. We just told you what an indicator should be like. Let's have a raise of hands, alright? I'll just read out a couple of indicators. Tell me if you think it's a good, bad or worst indicator. My indicator is reduction in the number of open defecation. How many of you think it's a good indicator? A raise of hands, let's have a raise of hands. Okay. How about percentage of women in the households using toilet? It's a good or a bad or a worst indicator? Good, how many of you for good? Okay. More diversified sources of drinking water facility. Do you think it's a good indicator? A bad indicator? Let's raise hands if you think it's a bad indicator. Or it's a worst indicator. Worst? Is he the only one responding? Guys, come on. How many of you think it's a worst or a bad indicator? A simple raise of hands.
Confused. How many are confused?
The fourth category, confused indicator. Increased awareness on hygiene and sanitation practices. This is the last one. Let's all raise hands at least on what? Good? How many of you think it's good? Okay, so let's see what they are. Percentage of women, obviously we're trying to be as specific as possible, so it's a good indicator. Increased awareness could have become better if we let's say, awareness increased was not there, right? Because like I said, it's better to have value neutral indicators, because that if you say increased, you are already assuming the change has happened, which is not a positive trait, right? But reduction in the number of open defecation, that's again a bad, because we are added reduction already. So the assumption is the number of open defecation has already reduced and I'm going to measure reduction only. But I'm just measuring number of open defecation, not reduction. Similarly, more diversified sources is the worst because that's very vague. We don't know what is diversified. We don't know how many more is more. One more is more or five more is a good thing. And diversified can mean many things. So we try to be as specific as possible to help indicate a better change. So as much as possible, let's try to create numbers, percentages, and specific and simpler ones. So women in households using toilet. That's a simpler, it's taking percentage, it's very specific, and it's counting something or a unit of information. This is the basis for results framework. If I try to articulate my theory of change in this language, I add my indicators at each stage, that simply becomes my results framework. That I have added my smoked pork related indicator. This is a little hard for indicators. While this was fun, this might be difficult to put indicators. But if we took an example of awareness and sensitization here in one of the activities, my indicators could be the number of awareness sessions held, right? And eventually the output could be awareness level of trained people, whether that has changed or not. So if you've written raised awareness, that's a theory of change. When I talk about indicator, it will be awareness levels. Because my theory of change takes into account change, so I can measure improved and write all of that here. So that's an example of how I might have my results framework. My input here is that I am training farmers to help improve their income. That's my impact that I want to achieve. Increase the farm-based income for farmers in a state, right? So if I go backwards, I need to measure the change in crop yield. Because if I have a higher crop yield, it might indicate that I have more income from my crop yield, right? So the indicator here would be the crop yield for farmers. So when I start measuring it year on year, the change will indicate whether that has changed or not, right? Whether there has improvement, there is decrease or what. When I go back to my output, how will my crop yield increase? Because I trained more farmers and they started implementing the practices for increasing the crop yield. So my output here is the numbers of farmers trained, the number of training conducted, change in the level of awareness of farmers on practices. Again, my activity was the training on improving agricultural practices. So number of trainings held can also be that way. Input was the number of hubs that I might have put up for trainings or the money that I might have spent on training. That can also, for that input would also have indicators, right? Because I'm putting in the budget, I'm putting in people. So all of those counted will also be an indicator. So that's essentially the crux of results framework. When we try to operationalize theory of change, make it measurable, we add indicators at each level to define our results, how we want to achieve our results. And that essentially becomes your results framework. Similarly, just here is what we did today. If I'm doing a training on M&E, my goal was that I want to improve what yesterday what our chief guest spoke about, right? That she wants to improve the program outcomes. She wants to improve maternal mortality. For that to happen, she needs that more of government officials are getting their programs evaluated. The initiative that is on monitoring is taken up by more people. So my outcome was that the number of government programs that are being monitored have increased. Or there's been percentage of schemes that are being evaluated in Meghalaya now are increasing, right? So percentage of schemes. Output for that outcome to be achieved, I would have had to train people and there would have been a change in the knowledge. So number of people with knowledge on M&E, if today it's 7 and after my trainings is 15, I would have indicated a change that has happened. And that change would only be possible if I looked at my outcome that you guys went ahead and started more monitoring of your programs. And activity again was training. So my training that I'm doing right now, whether or not how many of these training number of trainings that are being held. And lastly, input is the people, me and Kezia being engaged. For my organization, for this theory of change, if they're drawing, they need to show how many people went for trainings, how much money was spent on training, what was the infrastructure available, did we have to put in any effort for that? So that sort of thing.
Just adding on to the indicators, one thing that we need to keep in mind is we are often confused between whether to put number or whether to put percentage. For example, we saw percentage of women practicing XYZ, right? And then we are also saying number of people trained. So people are often confused in an evaluation and monitoring to whether put numbers or whether put percentages. So the basic thing here to understand is evaluation is always sample based, right? If I am to do an evaluation of this training program, I am not going to talk to each and every one of you. I'm going to randomly select a few and say that, okay, I have done a sample and I'm going to talk about proportion. So that is where percentages come in play. But if I'm doing a monitoring, I have a sheet outside with list of people who have attended the training. I will just go to all of them and I will just say that, okay, X number of people attended the training. I will not say X percentage of people. because it's not a sample. We are kind of doing enumeration. So whenever we are designing our indicators, we have to keep this in mind, whether this is a sampled kind of a thing, a sampled response, or is it going to be an enumeration. So that is why the number and percentages needs to be understood in the given context, whether we are doing monitoring and evaluation. Sometimes what happens, monitoring large-scale programs, in large-scale programs, monitoring also needs to have a sample. In that case, what we do percentages, right? And sometimes evaluation can also have, also needs to look at numbers. But ideally, the basic thing is, if we are doing a sample, then proportion. If we are not doing a sample, then we go with the numbers.
So, and just for a hint, you can look at the unit that you're trying to gather information on. So, if it was government programs being monitored, the unit that I have, I don't need a sample of that. If I have only a limited number of government programs that I work with, I can very well look at the number of programs. Like Asia said, for some things we might need to get a sample because it's not possible to go to each and every one. So there we focus more on percentages because it's out of a total something, right? This many people out of this many people, that's help us reach to a percentage. So percentage would be more applicable to a certain unit.